And we are back now with the smoke from the wildfires burning in Canada. We've been talking about this for more than a week, bringing dangerous air quality to millions across the country. Some states reporting an uptick in hospital visits now. Chief Medical Correspondent Dr. Narula is here with some tips to stay safe. And I know that we've been hitting on the different cities, and it changes day to day as that smoke kind of blows around in the lower atmosphere. But what are the health repercussions of being in this wildfire smoke, and who's most at risk?
So many people don't think about this, but there was actually a recent Stanford report that said that our exposure to smoke, there's no safe level. And the longer we get exposed, the more severe, more significant the health consequences can be. And actually, it's 10 times as toxic as our exposure to general air pollution from burning fossil fuels. So the smoke is essentially a mixture of gases, toxic substances, and these fine particles. It is those fine particles that are less than a third of the diameter of your hair that we really worry about, because those can get into your lungs, in your airways, and actually into your bloodstream. And so people can develop cough, wheezing, shortness of breath, chest pain, irregular heartbeats. It can exacerbate asthma and COPD, underlying lung disease, as well as cardiovascular disease, cause trips to the emergency room and the hospital. So it's really important to think about. And the vulnerable populations are a lot of people that are around us: the kids, the elderly, those over 65, those individuals who have underlying conditions like chronic kidney disease or diabetes or heart disease or lung disease, people who work outdoors, and those of lower socioeconomic status. So it really affects all of us.
Yeah. And Ginger, I know you've been following the wildfires closely, the air quality. How does somebody know as they're stepping outside going into the world whether the air quality is safe or not?
Well, my team and I live this because when we go to cover wildfires, we're very tuned in to airnow.gov. And that's what I would suggest to everyone is get to know that website. It's really easy and pretty intuitive. It will show you what level your air quality is. And so if you see it above 150, that is where you want to really start limiting time outdoors, and not just if you're in an unhealthy or sensitive group. This is a number that you don't want to be seeing. Above that, definitely. Below that, think about reducing the time. And that's the other thing is our exposure. You know, we'll be out there for 4 or 5 hours. I can tell every hour that goes by, there's a difference in how I'm breathing, in what I taste in my mouth. And so that's really important too, is just length of exposure.
Yeah, you can check those numbers on your phone there. Doc, how can we protect ourselves?
Yeah, well, you heard from Ginger, so you want to stay indoors on those days that are really smoky, and close your windows and use air purifiers or cleansers or filters. And then if you have an air conditioning unit, you want to basically set it to recirculate and close that sort of intake that comes from outside so you're not getting in the air. You can do things like avoiding indoor smoke, so not smoking, or wood-burning fireplaces or candles or your gas stoves. For those eyes that might be irritated, artificial tears, a humidifier can help. And then if you do have to go outside, again, avoiding strenuous activity and also wearing a mask or a respirator, that can help as well.
That is the best advice, Sarah. Thank you. We appreciate it. And Ginger, thank you as well.